Stroke affects about 800,000 patients a year. It's the #1 cause of major adult disability in the United States, and it's fast becoming the #1 killer worldwide. We're on the edge of an epidemic of stroke care if we don't figure out ways to improve the health of our population. We were a decade into the approval of TPA, tissue plasminogen activator, which is a clot buster that is useful in treating patients with stroke. We knew that it was modestly effective, and we were just beginning to realize that faster treatment was going to be a really important priority. We finally know which patients will benefit from a catheter treatment of their stroke if they have not responded to intravenous TPA. That treatment is so powerful that it will transform the way we provide stroke care in the future. In 2005, we had about 4 years of experience doing what we call telestroke, which is using video conferencing and collaborative evaluation of the patients to give our acute stroke expertise to patients in emergency rooms all around New England. It starts with a patient arriving in an emergency room that is partnered with us. That patient undergoes a CAT scan and a preliminary evaluation by an emergency physician who suspects a stroke might be occurring. At that point, they turn on a video conferencing connection, much like Skype, but more secure and of higher quality. So our physicians, they could be at home, they could be at Dunkin' Donuts, they could be in the hospital, are able to immediately provide expertise. All of that happens in the course of 10 to 15 minutes. Over the last 10 years, our network has grown to 30 hospitals in New England. That covers about 6.5 million patients. I will also say that that trend has now swept the world. You name it, there's a telestroke program being developed because it's such an effective way of bringing this expertise to the bedside and getting intravenous TPA started for the right patients. In the next 10 years, I'd like to see better diagnostics at the point of care. I'd like to see earlier treatment with drugs that protect the brain, not just open the blood vessels. And then I'd like to see a much more comprehensive understanding of our genetic risk and predisposition, so every patient has an individualized program that will get them back to the best health outcome that can be achieved.